Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. And I'm pleased to provide the Public Health Weekly Update with data accurate as of January 19th, 2023. This week, I'm going to continue what I've done the last 2 weeks, which are what are the best steps we can take to live as healthy a life as possible. Last 2 weeks ago, I talked about cigarette smoking and nicotine addiction. Last week, I talked about overweight and obesity. This week, I'm going to talk about something you may not expect, and that is sleep. Why is sleep so important to health and well-being? According to the Sleep Foundation, the relationship between sleep and overall physical health is well documented. It allows both the brain and the body to recover. It sure should feel refreshed and alert when you wake up in the morning, but that's not really the main issue. Obviously, not only sleep deprivation will make you feel tired, but it can also increase your risk for a wide range of diseases. And this is what's really important. This is not something that I learned in medical school. It's really evolving information, how important sleep is to our health and well-being. According to the CDC, it increases the risk of type 2 diabetes. And I'm going to go through these slides fairly quickly, but if there's any particular topic you're interested in, you can pause the video and look at that. It increases the risk of cardiovascular disease, including hypertension, stroke, coronary heart disease, and irregular heartbeat. It can increase the risk of obesity. And CDC especially points out that sleep in childhood and adolescence is particularly important for brain development, and chronic sleep deprivation in youth may have lifelong implications on obesity. The CDC also talks about the relationship between sleep and depression, in both directions, but particularly that sleep deprivation, limited sleep can cause depression. Now, there's other reports. In a recent article in Aging, they talked about the relationship between sleep deficiency and dementia. Such that there was comparing folks who sleep 7 to 8 hours a night to those who sleep less than 5 hours was associated with a doubling of the risk of dementia, and taking longer to fall asleep was associated with dementia. And this was backed up in another article from 2021 from Europe that looked at folks at 50, 60, and 70 and compared those with normal sleep duration to those with abnormal, and there was a 30% difference in risk of dementia, even correcting for many other factors. The other factor that appears to be related to sleep, and this is from a recent study at Harvard, is the immune system, and particularly common colds. So we see all of these chronic health conditions that are associated with inadequate sleep. But we have to remember that there's also very short-term acute issues, the most notable of which is the number of accidents. The National Highway Transportation Safety Administration reports 100,000 or so automobile crashes a year and 700 deaths due to drowsy drivers. But we see this in every field, and there's probably no field that's better studied than medicine in terms of the impact of lack of sleep on performance. And it's a low sleep compared with moderate and high levels among physicians was associated with a 50% increase in medical errors. And you can see that the combination of burnout, being exhausted and tired, and sleep-related impairment has a significant impact on the rate of errors. I'm not going to read this slide, but this is a paragraph from this same article, sort of in the introduction section, that talks about all the studies that have been done that show the relationship between inadequate sleep and performance. Now, we all get upset when we hear about physicians, but this is true for all of us, right? All of us, our performance goes down if we're sleep deprived. Now, we know that sleep is not a single entity, right? We all are aware of the sleep cycles, the so-called non-REM or stage 1 through 4 sleep, light sleep, the time of falling asleep, the onset of sleep, and then 3 and 4, the deep restorative sleep. This is the type of sleep that most people think are necessary for health and well-being, and then REM sleep, about 1/4 of all of our sleep. And these cycle through the evening 5 or 6 times. And in each case, they've well documented that there are differences in how our body is functioning during these times. We also know that sleep duration changes over time. Obviously, infants and toddlers have much more sleep than older folks, though by and large, adults pretty much need somewhere between 7 and 9 hours of sleep a night. Now, this NIH does give some recommendations for how to get a better night's sleep, because if you think about it, the other things we've talked about, smoking and obesity, we know how to impact, right? But sleep is a little bit more difficult. So they say stick to a sleep schedule, go to bed at the same time and get up at the same time, get some exercise every day, but not close to bedtime, spend some time outside, avoid nicotine and caffeine, especially the stimulants. They say don't take naps in the mid-afternoon, and if you do, keep them short. Avoid alcohol and large meals before bedtime. Limit electronics in bed. They're particularly suggesting that you don't watch television, you don't spend a lot of time on your cell phone while you're in bed. A good sleeping environment, cool temperature, get rid of distractions, dark, and so on. And then if you don't go to sleep right away, get up, do something relaxing, and then go back to bed. And if you have chronic problems with health, with your sleep patterns, they do suggest you talk to your healthcare provider, because there are some issues like sleep apnea and others that can impact it. I've seen somewhere else the idea that your bedroom should be for sleep and for sex and for nothing else. If you're watching television, looking at your computer, whatever, your laptop, that's going to be a distraction. There are also some policy issues we need to think about in terms of sleep. I think we've known for a long time that getting kids up at 5 or 6 in the morning simply doesn't work. Most kids, especially adolescents, don't go to bed or to sleep until about 11:30 at night. And so we know if you have later school start times, it results in fewer motor vehicle accidents, better grades, improved mental health. Now, there's a tension here between the needs of the parent to get the kid up before the parent goes to work. But maybe this speaks to our need to discuss the possibility of later start to the workday as well as the school day. Many folks in the sleep community are concerned about daylight savings time. That loss of 1 hour of sleep is associated with more motor vehicle accidents as well as cardiac events. And there's no real need for it in the modern world. And then obviously we need to advocate for policies that reduce the number of hours that anyone works, but especially healthcare workers, when their job requires clear-headed accuracy, driving trucks, anything like that. We need to advocate for all that. Now, one question that comes up a lot is, what about melatonin? Melatonin is a hormone. It's not a dietary supplement. According to the National Center for Complementary and Integrative Health at NIH, there's simply not enough information yet about the positive side effects, particularly in longer-term use, and particularly concerns with high-dose use. They also ask you to keep in mind a couple of things. Melatonin can interact with other medicines that you're on. There can be a risk of allergic reaction. There can be safety concerns for pregnant and breastfeeding women and older people as well. And remember, melatonin is regulated as a dietary supplement, not as a drug. The Food and Drug Administration, the Food, Drug, and Cosmetic Act was modified, I believe, in 1992 or 1993 with the Dietary Supplement Health and Education Act, which limits the particular role that FDA can play in regulating dietary supplements. And one of the realities with dietary supplements of any type is that it may not contain precisely what's on the label. So the bottom line is, there are some indications for melatonin, but you should really talk to your healthcare provider. I'm not a great fan of over-the-counter medications that can have a significant impact on health and well-being. In every now and then for shift workers and so on, people with jet lag, melatonin can make a difference, but we should not be taking it on a regular basis without talking to your healthcare provider. So what are the best steps we can take to live as healthy a life as possible? Well, I'm going to add get enough sleep and advocate for policies that promote adequate sleep. So again, don't smoke, take nicotine products, achieve and maintain a healthy weight, and get enough sleep. Please feel free to share this video with anyone who might be interested. I'm always happy to get new folks watching. And if you know someone or if you'd like to be added to our mailing list, we're happy to do that. All of our previous public health updates are available on the College of Public Health website. As always, I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. And importantly, if you have any questions, please let me know. If there's any topics you'd like me to cover, next week I will do an update on COVID. I'm going to try to just do that once a month, COVID and flu and RSV and any other emerging infectious diseases. So until next week, please be well.